I feel like I was struggling a lot with ADHD. Coming into college and having all that workload be put on me that's not what I was used to in high school, and I felt very stressed.
Right after high school, therapy ended for me, and I was transitioning into college. Finding a therapist who would meet my needs after high school was really difficult, so as soon as I was enrolled in SUNY Telepsychiatry and started my therapy journey here and getting into the program, that's how my journey started.
More students are coming to college than ever before with pre-existing conditions. College mental health services are overwhelmed, and the resources in the community are often very difficult to access, either financially or practically. So it can take a long time for someone to get a first appointment to seek specialist care. STPN started maybe 6 years ago with a small pilot in 4 schools with a very limited budget. Since then, we've grown to provide psychiatric services to 56 of the 64 SUNY campuses. We're very lucky that this program is funded by the New York State budget. So thanks to the legislature, the governor, and SUNY Central Administration, we can provide this service to students and to campuses free of charge. The problem that really it tried to address was incredible barriers to care, inability of students to access timely care. In a student's life, having to wait 6 or 7 months before getting their first psychiatric appointment is a lifetime. So STPN really has 2 main thrusts in its mission. The first one is to bring academic psychiatry to college mental health services. And the other is to leverage our psychiatric training programs to provide an excellent training opportunity for residents and also provide to students evidence-based care. We started with a small program in just 4 schools, and then each year we've added additional schools to the network, particularly having growth in rural campuses and in small community colleges whose psychiatric coverage is often non-existent.
The process of getting referred to telepsychiatry is really simple. Students will sit down with a clinician to go through a referral form on the website. The form covers some basic information like demographics, contact information, appointment availability. It will look at a little bit of pre-screening for risk, and then students will be sent a link to a patient portal. When they set up their patient portal through the telepsychiatry program, they will do a couple more screenings for symptoms, and then they will be scheduled with a provider. That patient portal is how they'll access their appointments and how they can send messages to the provider that they connect with.
It's been very validating because it's somebody telling you, I understand what you're going through, I see that you're trying, and it's somebody wanting to help me just become the best version of myself.
We've seen considerable decreases in measured anxiety and depression in our students. A big concern in college mental health is the risk of suicide. It's the second leading cause of death in this age group. So we hope that by providing early and easy treatments for anxiety and depression, we can actually reduce that suicide rate. I think STPN is a model for many other large state university systems. Having a centralized hub of specialist providers, whether it be psychiatrists, psychologists, nurse practitioners, social workers, really allows you then to leverage the academic medical centers in providing good quality care.
In our program, we're able to offer supervision to our third-year residents. What's really cool is that we're able to do it live, moment-to-moment supervision, where they get an immersive experience in trying to teach them how to conduct cognitive behavior therapy. I select the patients initially to make sure that they're appropriate for beginning therapists. We tend to work collaboratively. I'll meet with a resident, we go over what's going on with the patient, and then very, very gradually they are able to have more autonomy and more responsibility with the patient as they gain their skills.
And all I can think about is that I'm going to fail it. I failed the last one and I haven't been doing well.
Oh my God, it doesn't sound easy at all. So there's this thought that comes in about I have an exam, and then you have this emotion that, what do you think is the
I'm working with the SUNY Telepsychiatry Network as an elective part of my training in general psychiatry residency. I work with the students once a week where, I log on to the telepsychiatry platform and follow up with all the students. I'm doing diagnostics with them, different evaluations, prescribing medications, and then frequently communicating with the therapists as well.
Joining the network has been a game changer for our students. We used to have very limited services in this area, and now we're able to access a huge network of diverse providers, so our students can find someone that has an appointment time that meets their needs, may offer specialty care services, or just someone that can really assess what's going on for them, give diagnoses, and potentially start medication management for them.
I love working with college students. I think they're an excellent population. One of the reasons I went into psychiatry was to change the trajectory of patients' lives, and providing interventions, diagnoses and treatments at this age has the real potential to alter the trajectory. Students could then flourish rather than have the risk of academic failure, dropping out of school.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.